welcome everyone to this video. Today I'm going to talk about Tsinghua New Medicine, the Outstanding Clinician Scholar Program. 今天呢，我的题目呢是讲清华新医学卓越学者型医师项目。First, I'd like to welcome you to Tsinghua. I think Tsinghua University is a beautiful campus. You will enjoy all the offerings that Tsinghua can give you, which is one of the most beautiful campus around the world. I'd like to welcome you to Tsinghua Medicine. Now, Tsinghua University, as some of you would be aware, is one of the top universities in the world. In the latest ranking, it's ranked 14th out of all the universities in the world, and one of the top universities in Asia. Tsinghua Medicine started about 2001 when we slowly developed the different schools and faculties that became the foundation for Tsinghua Medicine. Tsinghua Medicine officially started last year in 2022, and I'm here to provide a vision for how we hope to train you as physicians. I'm going to try to ask you a few things while you're watching the video. First, why are we developing medicine at Tsinghua University? Number two, what do you need to know about medicine and healthcare? If you want to be a doctor, what do you need to know? How is healthcare changing? How is medicine changing? Number three, what is our very unique program at Tsinghua to train you to be a doctor so that you can be prepared for the future? Tsinghua has to develop medicine because it is one of the most important needs of the country and globally. We need to take care of healthcare because healthcare affects everybody. If we do not have good healthcare, if we do not have a population that is healthy, we cannot have a good country, we cannot have a good economy. Therefore, Tsinghua Medicine, when we develop this, we are hoping to address not just the country's needs, but also a global need. Let's look at what are healthcare problems of the future. First, we know that there is changing disease trends and there are different types of disease. China's population, as everyone may be aware, is aging rapidly. And from a very young population, we will have many old people. Some of them will be your parents, your grandparents. And we need to take care of their healthcare needs. Their healthcare needs are different from 20, 30 years ago. We'll be faced with many old age problems and many chronic conditions, such as diabetes, high blood pressure, high cholesterol. Second, we know that we can't simply add on more hospitals. We need new solutions. We need more doctors, but we also need better quality doctors. And we also know that we can't keep increasing the number of beds, the number of operating theaters, because it will add to the increasing economic burden for China as well as other countries. Third, we need to know what do patients want. We are aware that there is now higher expectations. Many patients want the certainty of treatment. They would like also timeliness, kindness, compassion, as well as hope. There are many patients and their families who do not accept that there's no treatment possible, and therefore we have no solutions. Therefore, future doctors need to understand that we need to take care of future patients' needs. Finally, we are aware that there are many scientific discoveries in the last 10, 20, 30 years. However, many of these discoveries are made by scientists in the university, in the research institutions, and some of them, and most of them in fact, have not been able to be applied in the hospitals for our patients. Therefore, there's a need to bridge this scientific discovery clinical care gap. Now, knowing these are the challenges for the future, how does Tsinghua hope to train you as a potential future doctor to address some of these very critical challenges? The first is we need to shift our thinking of healthcare. Instead of just treating late diseases, we need to go upstream. We need to go to the healthy population, and therefore we need to do preventative medicine, population health, to prevent disease rather than just treat disease. This is one of the areas of Tsinghua medicine that we're developing. Second, we know that there's a lot of technology. There's new artificial intelligence, there's a lot of big data, health informatics, and these are very important skills that our future doctors must understand and know. At Tsinghua Medicine, we will provide those information and skills for you. We also know that increasingly it is not just about the therapeutics, but it's also about engineering. We know that in the future, we would have robotic surgery, we might have telemedicine, we will have a lot of wearables and health monitoring. Therefore, our future doctors need to know bioengineering as a foundation for how they would practice. Our aim at Tsinghua Medicine is to train you to be not just a traditional physician, whereby you are only focused on what is known and the current and the present, and just delivering the care that is present today. We are interested in training you as a physician scholar. What is a physician scholar? A physician scholar combines both the patient as well as having an ability to do research and creativity and innovation. So a physician scholar looks not just now, but into the future, looking into creating new knowledge and looking at designing new treatments and new models of care, creating hypotheses, looking at unknowns. How can we tackle things that we do not know now? That's the aim of Tsinghua Medicine. Now let's look at our plan to train you as a physician scholar. We know that in the many medical schools in China, they are interested in training you for clinical skills only. We are interested in enhancing your research and innovation ability. And therefore, our outstanding physician scholar program is here to train you to have not only the clinical skills, but also research, academic, and scholarly activity that will create knowledge for the future. We also know that it is not enough for you to be trained in this 4 years with us. We will want to create the environment in our hospitals, in our healthcare system, what we call the Tsinghua Medicine academic healthcare system, that will elevate your skills while you are a resident and while you are a young doctor in our healthcare system. And we will create things like this program called the Center for Physician Scientist Development that will ultimately train you in our hospital system so that you can be either a physician scientist, a physician innovator, a physician educator, a physician engineer. Let's look at what we have to offer. Let's look at our faculty, then we look at our facilities. I'm very pleased and proud to say that we have a wonderful faculty that has breadth and depth of experience. This is led by myself and Professor Dong Jiahong. We have a whole cohort of faculty in different specialties. They are under Tsinghua's clinical tenure track system or our clinical system. Altogether, we have more than 100 teachers that's here to provide the best training experience in all specialties for you. Many of our teachers came from the best universities, not only from China, but internationally. And they will be our teachers that will train students such as yourself. We have also offered our faculty significant training program. For example, we've sent many of our physicians to Harvard as well as to other schools so that they are able to become trained scholars, that they can impart their knowledge to guide and to mentor you as a medical student in our curriculum. Let's look at our facilities. Let's start with our basic facilities. We have a medical experimental center that looks at pathology, histopathology, a specimens hall, and a physical function laboratory. These will allow you to have the best experience when you're looking at basic medicine to give you the foundations for you to go to clinical medicine. We also have a very established digital anatomy center that will allow you to learn anatomy as well as parts of the body in a normal function. We have in the School of Medicine significant research laboratories that are doing cutting-edge research so that they will be offered to you if you so wish to pursue research projects during your training with us. We also have laboratories outside of Tsinghua. For example, we have Beijing as well as national laboratories, including, for example, the Institute for Immunology, which is a world-class institute that does world-class research in immunology. Immunology is a foundation for many of our diseases, including COVID, cancer, as well as many other diseases. Let's move on to our clinical facilities. The School of Clinical Medicine was founded in 2016 by Professor Dong Jiahong, who is an academician of the Chinese Academy of Engineers and is the founding dean of the School of Clinical Medicine. Together with the team, we are able to provide a breadth and depth of clinical training materials and facilities. We have currently 3 affiliated hospitals, of which the Beijing Tsinghua Chang'an Hospital is an international hospital modeled after the Chang'an Hospital in Taiwan. It is the first-in-class hospital in China. There's advanced facilities with state-of-the-art equipment. There's a second phase currently in development that will be ready for you while you are coming into our hospital system for clinical training. We also have facilities that are accredited for residency, for fellowship, as well as for international programs. We are one of the first national clinical centers and training demonstration centers. There are only 5 in Beijing, and we are one of them. In addition, we have Simulation Center and Clinical Medicine Research Center. For example, our Simulation Center allows you to practice on real simulated anatomy and other specimens before you see patients. In addition to our clinical research facilities, we also have a breadth of world-class cutting-edge research laboratories. These are listed here, including molecular pathology, oncology, regenerative medicine, tissue engineering, medical imaging, and medical equipment. These are all available to you as your interest in these fields expand. Our idea is that these are intersection of different laboratories. So we would have digital and bioengineering laboratories, as well as physician scientists who will guide you from clinical medicine perspective. In addition, we have strong basic science, and then we also have clinical science, and that provides the nurturing environment for you to be a physician scholar in our training program. In addition to these research laboratories, we have several institutes that will also enhance your training ability. For example, we have the Institute for Precision Medicine, whereby we have many cross-disciplinary teachers, very famous academicians, as well as cross-disciplinary research centers and medical laboratories. We also have the Institute for Smart Hospital, as well as the Beijing Engineering Research Center for Key Technology of Intelligent Health Consortium that provides additional training facilities for you. Let's look a little bit more detailed now at how we intend to train you in our Outstanding Physician Scholar Program. Our aim is to train you to be an outstanding clinician, not only to be a clinician that has humanistic values, but also we will hope that you'll be a scholar, as well as you will also have research and creativity activities. Our programs are individually designed, and we have a few essential elements. Early on, we'll have early clinical exposure, so you'll be exposed very quickly to what a hospital and a healthcare situation are. We then expose you to early research training so that you also have the ability to do foundational research. Finally, we offer a whole range of international programs for you so that you have an international perspective. The early clinical exposure will be conducted in our hospitals. So in the first weeks of entering our program, you will be exposed and taught by our teachers in our hospitals, exposed to the operating theaters, to the imaging laboratories, as well as to seeing how patients are managed. I enjoy teaching some of these students who are currently in our program, and I hope that you'll also join me as I teach some of these early clinical exposure classes. Then we will expose you to early research training, so you understand the foundations of not just basic research, but also clinical research. You will participate in tutorials, in design of experiments, and hopefully be able to develop clinical questions as you become part of our student population. We also will expose you to other parts that we feel are very important for the future. For example, you will be able to take courses in global health, in behavioral science, in social determinants of health, as well as the hot topic, which is AI for medicine. We would provide many of you with career mentoring and opportunities. You will be able to interact with myself and other teachers to ask for specific advice. What should you do next? What should you go in a career in the future? We also have in our program many famous international speakers that will come by to do our global masterclass, our Future of Medicine classes. Some are done online, but some will visit us and will provide you with different perspective of the future. Now, these are our international programs and partners. You can see there's a whole variety of opportunities for you to study, to live, and to train overseas. For example, some of our current programs are done in the University of Pittsburgh School of Medicine. You can see some of the students from the basic 8-year program enjoying their experience overseas. We have signed up with MOUs with the top hospitals around the world, such as Sinai in Los Angeles, which is ranked the #2 hospital in America. We have also lined up UK, such as Imperial College London, which will also offer you opportunities to have exposure as well as training opportunities. Finally, we have a strong partnership with many Singapore hospitals and universities. For example, SingHealth Duke NUS and the Singapore General Hospital, which is ranked one of the top hospitals around the world, will be an opportunity for you to get some clinical exposure and clinical training. And we have signed MOUs with them. This is our president of Tsinghua signing the MOU with Singapore. But this is not enough. Even after you finish our outstanding physician scholar program, you are still part of Tsinghua Medicine, and we will continue to nurture you in our system. So we have developed, for example, the Tsinghua Medicine Center for Physician Scientist Development. And this program, which we just launched this year, will allow us to train you while you are in our hospital and while you are a resident or a young doctor with us. We hope to train you over the course of your career. We will provide you with ability to not just have clinical training, but also to have research and academic training. For example, this 6-month program will give you the skills to do your own research and to do your own clinical research program. This is our first batch of our outstanding physician scholar program. 2023 batch, there are 7 students here. We hope that you will be one of our students in the future. We welcome you to join us at Tsinghua Medicine. Thank you.